Be respectful of everybody's time, so we will get started. My name is Trish McFarland, and I'm president of the Delaware County Chamber of Commerce, and we are thrilled to bring to you today another Let's Have Lunch, a webinar with Crozer Health. Dr. Kevin Caputo will be our presenter today, and Dr. Caputo has been employed by Crozer Health since 1986. He began his career as a house physician and has had numerous administrative positions within the hospital. His title, Chief Behavioral Officer, encompasses two roles: Chairman of the Psychiatry and Behavioral Health and President of Psychiatry and Behavioral Health Service Line. He is currently an integral part of the senior management team for Crozer Health, as well as the Physician Director of Specialty Care, which includes behavioral health, women's health, surgery, and medical subspecialties. Under his administrative abilities and understanding the importance of collaborating with outside facilities, providing physicians in locations other than the inpatient crisis setting, the department, under Dr. Caputo's leadership, has grown from a few physicians to one of the largest departments in the facility within the 67 employed providers. Dr. Caputo has served as a resource for medical and lay groups, lecturing on the psychiatric implications of various pharmaceuticals, psychiatric illness, and suicide. He has also appeared on local and national television discussing post-traumatic stress in children, depression screening, and more importantly, the effects of that COVID-19 has had on the population he serves. So Dr. Caputo is going to go through his presentation now, and then there will be some interactive discussion at the end. Dr. Caputo, thank you so much for being with us and sharing your expertise today.
Trish, it's truly a pleasure to be here. So I'm hoping everybody can hear me. I always preface every talk I give by saying that I'm originally from New York. I'm kind of fast-paced, and I drink a lot of caffeine. So please interrupt me. I really, especially in the era of Zoom, don't want to hear myself talking into air. Let's make this as interactive as possible. Please don't hesitate to ask a question. There is no question that I ever consider stupid. In addition, sort of toward the end of the presentation, there are some cases that I'd like people to participate in. Nobody will be put on the spot. They're just sort of opinions. How would you handle this? How would you handle that? But I want to be a resource today. That's what my goal is, for Crozer Health to be a resource to help take care of yourself and your employees during this pandemic. So without further ado, let's get started. So I'm going to talk a little bit first about some of the statistics of COVID. So let's get going. Okay, so these are grim statistics. In the United States, there have been, and this was as of Friday, so the numbers are probably worse today, 13.3 million cases, with 266,000 deaths, unfortunately. In Pennsylvania alone, there were 356,000 cases with 10,337 deaths. And in Delaware County, we've had close to 20,000 cases and 850 deaths, unfortunately. So this has really hit home very significantly, and this is very real, as we all know. Why is this different? Why is COVID, coronavirus, why is this different than some other public health issues that we've had? Number one is it's highly contagious. It's, from what you read, anywhere between 3 and 10 times more contagious than the flu. Every season, the hospital gears itself for flu season. We prepare, we over-prepare, we get everybody vaccinated, and despite that, we're still kind of very full in the hospital taking care of patients, mostly elderly that suffer from the flu, sometimes younger. But this is worse than the flu. This is much, much more contagious. The other reason that it's different is you can be positive and be critically ill, or you can be positive and have a couple of symptoms: sore throat, a little bit of a fever, some muscle aches, and recover quickly. Or you can be positive having been exposed to the virus and not have any symptoms, which makes that sort of a walking time bomb, because that person who is positive without symptoms can infect many, many others. So that's what's kind of scary about this, is because it's so highly contagious, you can have a family member, friend, coworker test positive and be fine, but then infect several others. Why it's different, there's no standard cure. Not that there's a cure for the flu, but we have vaccinations and we have standard treatments of agents that we use, medicines, supportive treatments, fluids for the flu. So this is different. There is no standard cure. The other thing that makes this different is there's no vaccine. So obviously people are working furiously to get one out, but you can't be vaccinated for COVID yet. The fifth thing is that the symptoms are really variable. So, we have people that have diarrhea. We have people that have severe headache. We have people that can't breathe. And, as the disease emerged, it became clear that there was not one standard presentation. There wasn't one standard where you'd say, a patient would come in and we'd say, yeah, definitely COVID, because it was so variable. We looked at x-ray findings, we looked at a variety of things. The only way to really know that somebody has COVID is to do the test. And that tells us the person has COVID. But once again, once you have COVID, we don't know if you're gonna go downhill rapidly or you're gonna be okay quickly. So the symptoms are so variable, and I can't emphasize that. I mean, this is a disease that presents so differently. If you have diabetes, it can present one way. If you have a history of lung disease, it can present another way. So there's just a very, very wide range that makes it hard for us to diagnose it. And, the diagnosis comes about with the test, but it really is a very variable course. And then the last thing is the CDC guidelines are always changing. They actually changed again yesterday. So now if you're exposed to the virus, you quarantine for 10 days. If you're exposed to the virus and you're COVID negative, you quarantine for 7 days. So the rules are ever changing. I remember when this first started in March, they were changing sometimes 2 or 3 times a day. I happened to have the unfortunate experience of being the administrator on call the very first week that this started. And several times a day in our command center, we had to change the rules. And, with more exposure and with, the changing picture, I think they're going to continue to change. So that's what makes it very, very hard. It's not clear guidelines that we stick with and remain with for very, very many months. Any questions so far? Because I really, don't want to blow through this without addressing questions. If not, I'll move on. Well, here's the good news though. So the good news is this is highly preventable. So, everybody's heard this, but use your masks, practice social distancing, wash your hands with warm water for at least 30 seconds, follow the rules, whatever the rules are, follow the rules. And there's a good chance that you can prevent yourself and your loved ones from getting the illness. The other good news is a vaccine is imminent. I think the two dueling sort of things that are going to come to market are the Pfizer company and Moderna. And it sounds like it will be ready for distribution in the United States by the end of December. So that is great news. Both of the trials were very convincing scientifically that this is a vaccine that's going to be anywhere between 90 and 95% effective. It will require 2 doses, probably a month apart, but it's coming. So that's good news. There's a light at the end of the tunnel. The other good news is that treatments are getting better. There's a variety of different treatments now. If you develop COVID, that are able to either prevent it from getting worse or kind of stop it in its tracks and treat the symptoms. So I think the treatments are getting better as we know more about the disease. The last piece of good news is contact tracing is improving. So where public health is following, if there's an exposure, who that person has come in contact with and what the next steps are. So that's really, really good news. questions about the good news before I get to the flip side of the good news, which is the bad news? Okay, the bad news, okay, is we're weary. This has been a 9-month saga. And I don't mean to be sexist, but if you look at this as, if you've been pregnant, the most difficult pregnancy of your life, look at it as being pregnant with very high risk, with significant danger to your fetus, and significant symptoms, vomiting, you know, difficulty being tired, being nauseous all day, and fear of losing your unborn baby. So look at this as a 9-month saga that's continuing, because we still don't have the outcome. The outcome in a normal pregnancy is you have a beautiful baby that you love and you forget about all the stuff that went on before. We're at 9 months and that baby hasn't been delivered yet. So we're weary. This has been ongoing and we still don't have the outcome that we want. Second piece of bad news is winter is going to push more activity indoors. And the more indoors we are, the higher rate of contagion and the higher chances are you'll be in contact with more people, and chances are you have a higher risk of being infected. The third piece of bad news is the vaccine's still not here yet. It's on the way. And I think that distribution and number of doses, amount of doses is going to be contentious. I think the CDC is working on a plan of who gets it first, who gets it second. But I think that the county, the state, the federal government is all working on a plan of prioritizing who gets the vaccine and who gets it next. The fourth piece of bad news is many businesses, including healthcare, are suffering. We're hanging in there by a thread. The productivity is decreased. We've lost millions and millions of dollars, and we can't produce the way we used to produce because of all of the social distancing and the safety issues. A lot of restaurants have gone out of business. You know, we've pivoted onto takeout and we've pivoted onto social distancing and outdoor dining, but some businesses really can't pivot as well and they're suffering. And then lastly, although there are CARES Act dollars out there, it's not clear how they're going to be doled out or when they'll be doled out and who's going to get what. So we're kind of going to be dealing with a pool of money, and we are already dealing with it, but it's not really clear cut and it's not as straightforward as we'd hoped it would be. I'm going to go on to what we call the second pandemic. And the second pandemic is really different than the second wave. We had our first wave in March and April, and that was people testing positive, getting sick, going into the hospital. That was March, April, May. That was a tough time for us to see a lot of people sick. We started to practice some social distancing. We started to do things, really step up our masking and our hand washing. And then we took some steps backward. September, October, and Thanksgiving, we took many steps backward. So now we see an increase significantly at a point in time, I would say in maybe August, September, we had patients in the hospital with COVID in the single digits, 7 or 8 patients. Yesterday's count, I believe, was at the Crozer system, Crozer Health, 112 patients. So we've seen a marked increase in this second wave. But the second pandemic is what is referred to as the mental health sequela of the coronavirus. There have been such changes in lifestyle and business that we've really seen a lot of other things happen related to the mental health of patients, even without coronavirus. And in addition, we've seen a number of other changes that have taken about, at the same time, that include political unrest, economic uncertainty, underemployment and unemployment, homeschooling, which adds another dent into the stressor level, remote work, which sounds like a panacea, but there are pluses and minuses to remote work, and social isolation. How many people really wish that they could spend Thanksgiving with their loved ones, not just a couple, but with large groups that you had done in previous years. That is not possible, and in all likelihood won't be possible during the December holiday season as well. So what that leads us to is what we need to do as managers, leaders, and employers. I think the top priority is we have a responsibility for our employees to create an environment that is open, that allows employees during this stressful time to put everything on the table. We need to remove any barriers that make it difficult for our employees to come to us with any issues, any problematic issues. So, sorry. We went ahead a little bit, but give me 1 second. We'll go back to the previous slide. Okay. Little technical challenge. Here we go. So what we really need to do is we need to put mental health on the table. We need to let our employees know that it's okay to talk about mental health issues. It's okay to talk about how we struggle, that it's not a weakness, that it's a commonality among all humans during this pandemic. We're all struggling. You know, the employers, the employees, any guru out there, anybody who's considered an ideal leader is struggling. This is a time that we need to be able to say it's okay to struggle. You're not weak, you're human. So we need to give that message to our employees. We also need to invite others to talk about it. We need to be able to check in with them about their mental health. And we're going to go through how to do that best. And we also need to destigmatize it. I use the example here that says, hey, you tore your tendon, how's your foot? By the way, how's your mental health? That's not an intrusive, leading, difficult question. You're not poking at anybody. And I would tell you 99% of the time that you ask that question, the person that you ask it to is going to feel relieved. They're going to feel like, wow, they really care about me. They care about me as a whole human being and not just about my tendons or my physical symptoms. So before you can do that, though, as an employer, a manager, a leader, you have to sort of give yourself this checkup. You have to ask yourself these questions, because if you're going to help others, you need to have your acts together as well. So you need to ask yourself the following questions. Am I pervasively sad or disinterested? Now, I use the word pervasive there because you have a bad day, you're going to be sad. Somebody dents my car in the parking lot, I'm going to be sad. I'm working on a issue at work and it's boring, so I'm going to be disinterested. So, I mean, the question is, are you sad and disinterested all of the time? Ask yourself that question. Second question to ask yourself is, do I get pleasure from anything? Yeah, we're living under very stressful conditions right now, but can I still feel the joy in taking care of my kids, sharing a meal with a significant other, watching a TV program? Can I still chuckle at what I used to chuckle at? How is my sleep? Am I sleeping all day because I have no energy? Or do I have disruptive sleep? Do I get less than 6-7 hours a night because I wake up a lot or I wake up in the early hours of the morning? How's my appetite? Do I have no appetite? Have I lost 15, 20 pounds because I'm so sad that I don't even feel like eating? Or am I binging and going to that refrigerator for comfort nonstop? Have I put on 15, 20 pounds? Am I drinking more than usual? Am I drinking because I'm bored, because I'm restless, because it makes me happy? Do I feel helpless or hopeless about life? And once again, we've all felt hopeless or helpless about a situation, but is this a strong, pervasive feeling? Do I feel that way every single day? The last set of questions to ask in this part of the checkup is, do I have thoughts of giving up, dying, or harming myself? Believe it or not, it's normal to have a fleeting thought like that once in a blue moon, but if you have a lot of those thoughts, that's of concern. Do I feel worthless? Do I feel like I don't have value in this world? Have I had frequent crying spells? Have I had frequent angry outbursts? Stereotypically, women cry and men have angry outbursts. But with gender fluidity, with people changing roles, that's not necessarily true. But am I crying a lot or am I having angry outbursts? Is my energy level low beyond the point that it should be? I don't have this printed, but have I had very, very poor concentration and difficulty making decisions? And do I feel extremely slowed or extremely sped up? All of these questions that I ask you are kind of signs and symptoms of depression. And while you may have one or two here and there, if you have any of them for a solid 2 weeks straight, you're clinically depressed. Second part of the checkup is, am I worried, anxious, or fearful more than others? So yeah, we're all worried. We're all anxious. Nobody wants to get COVID. We worry about our kids. We worry about our loved ones. But am I at the extreme where all I do all day is think about things that can go wrong and worry? Can I relax at all without alcohol? Can I kick my feet up, put my work behind me, put my thoughts of the world is a different place right now behind me? Can I relax? Am I tense and irritable most of the time? Do people around me feel like on eggshells because I'm so tense and irritable? Do I have more aches and pains that can't be explained? Are there do I have a stomach pain for no reason? Do I have back pain for no reason? Do I have some of those things where my focus is on my body and generally I'm pretty healthy? Am I afraid of things more than others? Have I panicked? And what's panic? In my world, panic means you're extremely anxious and you have physical symptoms like your heart is racing, you're short of breath, you feel like you're going to pass out, you feel like you're going to die. That's panic. Am I over-checking things to the point of being inefficient? Do I keep checking the stove, the door locks? Do I wash my hands 20 times a day instead of the 10 that I'm supposed to? Am I worried about things to the point that I'm inefficient? And lastly, do I feel numb, detached, or unable to register any emotion? Am I just going through the motions like a robot? Do I feel so traumatized that I really can't register any emotion? The first set of the checkup relates to depression. These symptoms really relate to anxiety. If you have any of these things for long periods of time and it describes you in a nutshell, then you have an anxiety syndrome. And that is something that has to be dealt with. So if you're depressed or anxious, try the following strategies first. Talk to a close friend, talk to a confidant, tell them what you're going through, confide in somebody. I always say, like, if you can confide in somebody, sometimes just letting it out helps. Sometimes just hearing it's okay, I feel the same way, or don't worry, I felt the same way and I've gotten help, or here are some suggestions for you from your close friend. I know you and you always do A, B, and C, try D, E, and F. Secondly, avoid alcohol, get sleep, and eat well. These are basic common sense things that really can help you feel better emotionally. They can help you with some anxiety symptoms and some depressive symptoms. The last thing is, if you're really not getting any help and you're not getting better, then get some professional help. First and foremost, always contact your primary care doctor. We train primary care doctors on how to recognize depression and anxiety. And for simple syndromes, they're very good at treatment. Also, then, if that's not helping, then get to a therapist. A therapist is typically either a licensed clinical social worker or a psychologist, somebody that will help with talk therapy. Most of the talk therapies now are online. You can connect with a therapist and they will help you with some coping strategies. Lastly, a psychiatrist, and please understand, psychiatrists don't see people that are crazy. Like, that's not what we do. We see people for talk therapy as well. The difference is that we have medical training and also can prescribe medications. So most psychiatrists are therapists, and then also our physicians. So that what they do is they can treat you holistically by looking at the therapeutic issues as well as the medication issues. I didn't put it down, but there's a number 610-874-5257 where Crozer Health can help you hook up with either a therapist and or a psychiatrist. That's 610-874-5257. Questions before I move on? Because I've kind of like giving a lot of information and talking to air. Does anybody have a question for me? Okay, hearing none, I'll move on. So there's a statement called physician heal thyself, meaning that you can't take care of other people unless you have your act together and you're doing well. And I've kind of modified that with employer heal thyself. So if you as the employer, leader, manager are not doing well, please get help yourself so that you can help the others. Remember, as an employer, leader, manager, you're a role model and people look to you for guidance and advice, and you have to walk the walk and talk the talk. So if you need help, get the help so that you can help others. Okay, so how to help your team. This is sort of the crux of really what I want to cover today is number one is talk about health holistically. So I use the leg tendon issue, but the example is, it sounds like your back pain is better. Great. How's your mental health these days? I know these are stressful times. Please let me know if I'm overstepping. Put it out there. Like, give your employees a chance to say, hey, I'm doing fine, or mind your own business, or I feel really nervous, or I'm worried that, you know, A, B, and C is going to happen, or I'm worried the company is going to go under, or I'm worried my husband just lost his job, my wife is just lost her job. Whatever it is, put it out there. Once again, if you don't ask, you don't know. And I do think you'll be pleasantly surprised that A, you're not going to be overwhelmed with requests, and B, it's going to be a very rewarding experience for your employee. Two is share your thoughts, struggles, and concerns. So if you say, I too am worried about this, this helps to normalize the situation. If I come across like I'm the know-it-all that's invincible, it's hard to approach me. But if I say, you know, I've struggled with sleep problems as well. What really helped me was setting an alarm every day and going to bed at the same time. Have you thought of doing that? It's okay to feel this way. Basically, you're giving people permission, your employees permission to feel vulnerable. And once again, I'll say this 20 times, feeling vulnerable is not a weakness. I mean, it's an illness. We're dealing with depression, anxiety, and adjustment issues. So it's not something that you should feel ashamed of. When you listen to employees, don't try to fix things. I think the tendency for most of us that are high-powered is to hear the problem and immediately come up with a solution. Sometimes just listening to the problem allows an employee to sort of put it out there and rework things. So your job as the employer is to lead the employee to resources. You know, from a human resources perspective, what's available. You know how to access help for your employees. So you want to lead them to those resources. Don't offer concrete solutions. Concrete solutions, in some ways, although they're well-meaning, shut the employee up and say, do this, do that, do this. In all likelihood, the employee has thought of probably 90% of those things, but for some reason can't do them. So you want to listen, but not offer concrete solutions. You may talk about your experience, but understand that's your experience. You also always want to make sure that you don't imply that the employee is broken and needs to be fixed, because I think that's something that you need to be sensitive to. So really listen when you help your team. Really, really listen. I mean, put on your listening hat and suspend judgment. If you're talking as much as the employee is, or even 1/3 of the time, you're probably talking too much. You want to suspend judgment. You don't want to say, oh my God, you did that. That's not really going to be helpful for the employee. You also want to separate your employee's experience from your own. What you've experienced is really based upon your own coping strategies and your own life. So you want to not think that it's one size fits all. If somebody's struggling with depression, maybe you went and saw a doctor and got an antidepressant. Maybe your employee really needs to just talk things out a little bit and doesn't need medicine, just wants to sort of make sure that what they're experiencing is normal during these times. You want to listen for themes. If the themes are, I've had multiple losses, then you need to sort of pick up on that and say, I hear that you've had lots of losses. Let me get you help. Those kinds of things. I always say listen with your eyes. A lot of the information that's conveyed to us is through body language. So when you listen, try to do this via Zoom or via, if you're not in person, which most of us are not these days, try to do it by video, because you'll pick up, you don't have to be a psychiatrist or an advanced therapist to pick up on some of the nonverbals. So listen with your eyes, watch the employee, see how they present things. I think that's really important. And then the other thing is, this should be sort of private time. So if you're getting interrupted and there are lots of distractions, phone calls, emails, whatever, you want to suspend your meeting with that employee and reschedule at a time that both of you can fully attend to each other. It's really important because people need undivided attention. And I want, that's really important during these kinds of talks. Any questions thus far before I move on? So a couple of tips to help remote workers. One of the things is I would use, and I'd actually almost mandate a video platform, because the more you can see people, the more connected you are to them. When people participate by phone, they're participating, but they're typically multitasking and they're not really present. You also want to periodically send a handwritten note. A handwritten note from a manager, from a leader is very, very powerful. To just say, hey, I'm thinking of you. Thanks for participating on the call yesterday. That is really, really powerful. I've done that with a number of my employees, and I can't tell you how satisfying that is. Develop newsletters in your companies. What's happening in the company? That fosters inclusion. The more people know about things, the more connected they are, and the better they feel about their employment. Send, when applicable, a small present from the company, or a birthday card, an anniversary card of their employment. Send something to let your employee know that you're thinking about them and you want to take care of them. Do what's feasible for your organization. I'm not telling everybody to send, something expensive, but some token that shows that you're being thought about and that you're still included and still part of that workforce. Once again, connectedness is really important during this time of social isolation. One of the things that I learned from my CEO, Peter Adamo, is to start every meeting by asking if anybody wants to thank a colleague or a manager. You'd be surprised how powerful that is. It sets a great tone and a great atmosphere for letting people know that they are thanked and appreciated. It really is a very feel-good experience. It's not like group therapy, but just we start out by saying, does anybody want to thank anybody for something that's happened this week? And it's, once again, extremely powerful. And then the other thing that I do that I would recommend is send periodic random emails to employees just to thank them for their service and participation during the pandemic. I think that people need as many positives as they can get now when faced with the negatives that they have little control over. You can help guide this and you can control this for your employees. I think that's really, really powerful. Questions? I'm going to do some cases, so hopefully you've all saved your voices for now and will participate, because these are, I'm going to really need participation. And once again, don't feel intimidated. There are no specific right answers. These are issues that we're going to try to resolve together. They're just some cases that I made up, and purely fictional, no names or anything like that. And let's have a little bit of fun with these and try to use some of the things that we learned earlier on in this presentation. So anybody have any comments or questions thus far? Okay. The first one, case one. Frantic Fran is a 10-year employee with an excellent track record. She is working remotely and has been late for every meeting. She has always been on time before COVID. In addition, she has been about 50% productive and has not followed through with many tasks. What's your first step here? What do you do as her manager, employer, leader? Anybody want to help me out and talk?
I'll help. So would you just reach out to Frantic Fran and kind of touch base and just have a conversation, see how everything's going, what's going on with her life, kind of a personal conversation? Would that maybe be step one?
Yeah, exactly. That's what you want to do. You want to have a personal, private conversation with her, preferably video, but if not, you would do it by phone and you'd say, hey, I'm really concerned about you. You know, you really have an excellent track record. There are a lot of things that really haven't gotten done. There's some follow through issues. Hey, I'm concerned about you. And see what she says. All you're doing is you're not being a therapist. You're not being intrusive. You're not coming up with a diagnosis. All you're saying is, hey, I'm worried about you. I'm concerned about you. So that's exactly what you should do. Anybody have any other thoughts or comments on what they would do? Okay, so she tells you that she's having trouble sleeping and managing her 3 children, ages 8, 10, and 15, all of whom have ADD, attention deficit disorder, and are being schooled virtually. Having one child with attention deficit disorder is hard. Having 3 at home that you're trying to manage is probably impossible. Her husband is a teacher and he's teaching while the kids are in school. You have seen all 3 kids appear on camera impulsively during Fran's meetings. How do you proceed?
I would say maybe first thank her for being open and transparent with you.
Great.
And then maybe ask her what would be something that would be a helpful solution for her, or how she envisions making things a little bit easier right now.
So that's great, Amy. What you're doing is you're thanking her, which I think is very important for participating under these conditions. What you're saying is, hey, it's really hard for all of us, but it's especially hard for you. You have 3 kids that are being homeschooled. Thank you for revealing that they all have attention deficit disorder. Thank you for telling me that your husband's, a teacher and he can't really attend to the kids. Yes, thank you for revealing all that. How can we help you? What do you want? Is there something that we in our company and our organization can do for you? And let's say she then, go on to the next slide, says, Fran becomes tearful and says, there I go again. I seem to cry at the drop of a hat. She's lost 15 pounds without trying to. Prior to COVID, she wore makeup and always looked presentable. Today, her hair is pulled back and she has no makeup on and looks sloppy. How do you proceed?
Maybe just let her talk and tell her it's okay to cry. That you're here to listen, and what else is going on, or just kind of make her feel comfortable enough that she can continue to open up.
Yeah, I think that you want to create an environment that makes it comfortable for her. She's already saying she cries a lot. She's telling you that she's not eating well. She looks disheveled. This is not her standard presentation. So you just validate the fact that she's suffering. You say, I'm sorry, I'm very sorry that you're crying now. It sounds really difficult for you. I would like to get you help somehow. Are you willing to get some help? That will go one of several ways. She'll either say, oh, no, I'm fine. And then you can't make her get help. Or she'll say, yeah, I wish there was some help out there for me. And that help could be, referring her to human resources, referring her to treatment. This case that I sort of put together is building a case that she's probably clinically depressed. Not that you have to diagnose that, but you would basically refer her to human resources, whatever, if you have EAPs, whatever you have It sounds like, the good thing about Fran is she has a good enough relationship with you as her manager that she's telling you information, she's giving you some data. You as a supportive leader are saying, I'm sorry, but I can help you. And that's really the way this should work. So that's good. So you want to get her some help. Questions or comments about this, or?
I was just going to say it'd be a good time to offer up the EAP.
I'm wondering
Go ahead.
if, as you're talking and as you're proceeding, what if she doesn't want help?
Okay.
What if she says she's fine, right? Like, I'm okay, like, I'm just having a bad day. Like, how would you go from there?
Yeah, so I would say, obviously you can't make her get help, but you then say to her, well, I am concerned about you. You're crying, you've lost some weight. In addition, I am concerned about your job performance. You used to have everything really, in on time, used to be very productive, and I'm concerned that something's happening. So I just want to let you know that I am concerned about you. And if you do want help, I'm here. Why don't we check in about a week and see how you're doing? So that way you leave the door open. A lot of times people don't want help and you can't make them get help. There's nothing about this case that makes you say, oh my God, I got to do something immediately. As a psychiatrist, I think she's probably depressed, but she's not at risk to harm herself. And I think that she's, probably going to need help, but she has to want that help. But if you also throw in the piece about, I'm also concerned about your job performance, you're 50% productive and you're not handing in things on time, that kind of hits home for some people because they say, oh God, I didn't realize I was not doing what I'm supposed to be doing. I feel like a wreck at home because I'm taking care of 3 difficult kids, but it's also affecting my work. And that may be the motivator for her to get help. That's a good question, though. Very good question. Other questions? I'm going to go to, somebody was talking before, but I couldn't hear them. It sounded like a male voice.
Yes, doctor. How you doing?
Hi.
My name's William Dennett. I just was following up on that there. The one thing that I've noticed, through the workplace, I guess through the reassurance, for the positive thing, I always try to put a positive spin on something. But at the same time, do you really want to put, the negative aspect of saying like the work performance of being, at 50% and stuff like that? I think with the COVID going on, obviously a different situation, but I don't know. I don't know if, and from what I've gone through, just if I want to throw that out there, just for the simple fact of somewhat maybe using this as a bad word, being afraid to upset them even more, is that something, or how do I get through that? Or how do I get myself past that?
So I think that the way you worded it is really critical here. So you're not threatening them. You're not saying, and your work performance is poor and we're going to discipline you. What you're saying is, I am concerned about you because you used to hit on all cylinders, used to do really, really great. And I'm concerned that perhaps you're overwhelmed because you're not performing as well. And I would preface it by saying it's very tough when people work remotely to be productive, but I do think that you could probably do better. I want to help you. So as long as you're emphasizing that that's not like a, haha, I'm going to write you up. It's more of, I'm concerned about you. Like, you're one of my stars. And right now there's some problem and want to help you get better so that you can be a star again. So I think it's all the way you word it, but I wouldn't be afraid of going there. Most of the time when you do bring that up, believe it or not, people are relieved. People say, wow, like, I guess it is affecting my job performance. I know I'm really, really at wit's end with the kids here, but I didn't realize that I wasn't doing as well as I could be doing. So once again, you pointed out in a non-threatening way that, tells them like you're on their side, you're there to help them, and anything you can do to help them. Maybe in that situation, she says to you something like, is there some way that I can shift my hours and that can be much more productive if I can work later in the day, and there's some accommodation that you can make for her during this time to make her more productive, but also to address her mental health needs.
I got you. Okay, thank you.
That was a great question, though, because I think there's always a fear of, like, do I bring this up and do I make somebody worse? Do I make them feel worse? And I have to tell you, 99.999% of the time, when you bring something up that somebody is dealing with, they're more relieved than anything else, especially if you're bringing it up sensitively with their best interest at heart.
Okay. Thank you.
Sure. Other questions? Comments? I'm going to go on to case 2. Okay. Faithful Fred is a 51-year-old single male who moved in with his parents, who are in their 80s, to take care of them just after COVID emerged. He's never married, is an only child, and describes his parents in quotes as his life. He has always been high-strung, but tells you many times a day that he's so afraid something will happen to his parents. He says he cannot relax and won't be able to until a vaccine is out. What do you do?
This is Chris Marin. I would say, again, starting at the point, everything he's talking about here is regarding his parents. You maybe just turn it around and ask him, genuinely and sincerely, how are you doing?
So great. So he's very worried about his parents, and he's your employee. His parents are not, and you want to say something like, it's great that you're able to take care of them. They're so lucky to have you. Sometimes taking care of elderly parents, especially during a pandemic, can be really hard. How are you doing? That's a perfect entree into that. And he can say fine or not fine or whatever he says. At least you've opened the door. All you want to do is make it comfortable for your employees to verbalize. So let's go on to the next part of this. Fred comes to work looking exhausted, even with a mask on, and says that he cannot sleep. All he thinks about is his parents' safety, despite the fact that they're housebound and healthy. How do you proceed? Anyone want to take a shot at this?
Dr. Caputo, maybe connect him with a resource to explain to him from a higher level that his parents will be okay if they follow these rules. Just give him some extra reinforcement, positive reinforcement that everything will be okay.
Yeah, so I think you're giving that to him as the employer, but he may need to hear that from a third party, objective, maybe professional, that his parents are safe, they're not leaving the house, that he's taking good care of him. That's very noble that he's doing this. So you may at this point say to him, would you like to talk to somebody? Human resources may be able to hook you up. We can help you, which is great. Open the door and see what he says. So going to the next part of this, Fred comes in the next day reeking of alcohol. Before sending him home in an Uber, he tells you it's the only way he can relax and get to sleep. What do you do? Okay, this is where you make that professional intervention. You say, now, like he's drinking, maybe he's clinically anxious and he's using the alcohol to calm himself down, but he can't come to work reeking of alcohol. So this is where you definitely say to him, I am very concerned about this behavior. I want you to get help. I need you to speak to HR, who will then hook you up with a professional, because treating your anxiety or your sleeplessness, insomnia with alcohol is definitely not the way to go. So that's, you hook him up with resources definitely now. Perhaps earlier, if he was able to say, yes, I'll go now, that would have been easier, but he didn't say that. So we're at this point where he's drinking, and we call this self-medicating, but we really we gotta get him some help. I'm gonna go to case 3. Loud Larry is a 23-year employee with a better than average work performance over the years. He's always been respectful and pleasant and gotten along well with his coworkers. You find out from a close worker that 2 of his brothers have died of COVID-19 and his extended family of nieces and nephews are all positive. Do you do anything at this point?
Caputo, I think there you may not want to say anything because he could be not saying anything to you just because, especially if you're his boss, you know, directly, just because he could be embarrassed or you don't really want to put him on the spot for something that, you know, isn't necessarily his fault, I guess, if that makes sense.
Yeah, so there's no wrong answer to this question. So you answered one way, which is perfectly acceptable. You don't have to do anything at this point. You're not obligated morally, legally, like, you know, ethically to do anything. If you have a rapport with Loud Larry, then you might want to call him in and say, hey, I heard that 2 of your brothers have died of COVID-19. I'm really sorry about that. How are you doing? But once again, like, there's no wrong answer to this question. It's what you and your relationship with Loud Larry is like that dictates what you do. So on today's conference, Larry is uncharacteristically loud, angry with coworkers, and interrupting as well as over-talking them to get his point across. While he is correct in principle, it has left the team sullen and defeated. Do you say anything to Larry now?
Maybe I would just, not even just a phone conversation if we are working remotely and it's something that couldn't be in person, just say to Larry, hey, is everything okay? And maybe if I hadn't said anything when I found out that his brothers and nieces and everybody had COVID, I would say, hey, are you okay? Like, obviously there's things going on in your life that we know about and we're really sorry to hear that, but you're not yourself. Like, what's going on? I might do something like that.
Yeah, I think that would be perfectly acceptable at this point. Like, the words that I like to use are, I'm concerned about you. So I think those are very powerful words. And Larry can say, I'm fine. Like, you are concerned about him, but you're also concerned about the team. I wouldn't tell Larry that the team has felt sullen and defeated because of his behavior. But yeah, throw it out there, say like, hey, are you okay? Or I'm worried about you. Larry confesses that he is angry with the world, the disease, and people in general for passing this on to his brothers. He apologizes and says he'll try to watch his attitude next time. In the next conference call, the very next day, Loud Larry is worse, using profanity and telling his coworkers that, in quotes, people don't have integrity. Why should I believe you about anything? How do you proceed?
My first thought is we'd probably have to stop the conference call and kind of have that, you know, addressed immediately to kind of stop the extra ramifications on that. And then my first thought would be to get Larry help and access to resources, whether it's a direct referral or, you know, kind of HR piece. And then secondarily follow up with the team and let them know that, you know, you're addressing it, but it's a private matter.
Absolutely. I think Loud Larry may not realize how he's coming off. That's the problem here. So the fact that he's so angry, there are a variety of reasons why he could be angry. We know the reason that he's angry, but there are, you know, he could be depressed. He could be just angry. He could be anxious. But I think the issue is get him some help now because he is self-destructing and he's also destructive on the team. So you do want to get him help immediately. So yes, stop the conference call, get him help, and then move on. I'm going to go to the last case. Grateful Greta has twins at Penn State who are turning 21. She's considered essential to your business and attends in person every day. She's telling a coworker about the surprise party she's throwing for the twins with a guest list that she's skinnied down to 20 people because of COVID. Greta has told her coworker that she just remodeled her house to accommodate the group. A coworker comes to you to solicit advice. How do you proceed?
I guess my first thought would be to maybe take the route of, you can't, the coworker can't control this situation and can only just do her best to trust that her coworker is taking all the necessary precautions to have the event for her children. And just try to give her that constant reassurance that, I'm sure in the office setting, there's the same kind of precautions being taken. And so that if she's nervous about anything, that, just try to reassure, we can't control what everyone else is doing around us, but we can control our own actions.
Yeah, I think that you can't control what other people are doing. If you have a rapport with Greta, or somebody has a rapport with Grateful Greta, then someone has to have a conversation. I am concerned about what you do. I have no control of what you do in your outside life. I'm your employer. I'd hope that you're practicing safe distancing, and I'd hope that if you were putting those around you at risk, that you would not do the same in the employment setting. Now, you can't mandate her do anything. You can't say call the party off or you're fired, but you still want to let her know that she's subjecting her coworkers to potential danger. So, but once again, you have no legal authority to changing that. In conclusion, I just want everybody to remember the 7 Ps of the pandemic. And this is just something I made up. You won't see this anywhere, but you have to be passionate in what you're doing. You have to be passionate about living life every day and being vigilant. You have to be patient. I mean, this is an exercise in patience. For those of us like myself that are impatient, you really have to wait this out. You have to be persistent. I think it's really important that we keep masking, we keep washing, we keep doing all the social distancing that we're asked to do, because without that, we're really not going to be in good shape. Pivoting, you've heard me use the word pivoting a couple of times today. What I tell you today, the CDC may change tomorrow. There may be different rules, different treatments. So you got to be nimble in this pandemic. You can't be rigid and fixed on one thing. You have to keep persevering. This is hard work. I mean, this is hard work. You already have jobs that are hard work. So add this and all the layers on top of it. And it's really, really hard work. I also tell people to be pensive. Think about your actions. I mean, this is not a time to act impulsively about anything. And lastly, I'm a positive kind of guy. The glass is always half full to me. So be positive. Help is on the horizon. We should have a lot of hope, and we should foster that hopefulness in all of our fellow human beings, especially our employees. So the 7 Ps of the pandemic, and I'd be happy to answer any more questions. We're running short on time, maybe overtime, but thank you so much for allowing me to talk today.
Dr. Caputo, this was amazing. Thank you so much for being with us. Very insightful and very helpful. And I hope everybody else feels the same way. We know you are so busy. We truly appreciate you taking time with us this afternoon.
My pleasure. Take care, everybody, and be safe.
Thank you.
Thank you. Thank you, Kevin.
You're welcome.